At the State House now, a state agency that advocates for abused and neglected children, warning lawmakers the system is under serious strain. Here's News 19's Josie Frost.
We are in a terrible situation.
Margaret Bodman is the interim state child's advocate of the Department of Children's Advocacy. The agency is asking for $1.5 million to go towards the state's Continuum of Care, a state program that provides care to kids with severe emotional and behavioral diagnoses. They say that money is needed just to keep the program afloat after they lost the Medicaid waiver that once paid for some services for clients.
Trying to keep our youth out of DJJ facilities, out of DSS care, and frankly, out of our psychiatric hospitals. It's finding the funding to be able to do that work and keep the staff.
The department is also requesting $750,000 for the Children's Trust of South Carolina, a nonprofit that works to prevent child abuse. The money would help expand a home visiting program that works with new parents. If it's funded, they can pull down more than $2 million in federal matching funds.
Our work needs to be on both ends of abuse and neglect, is the prevention work as well as the response to it and accountability.
In lieu of that, the governor has proposed a bigger funding boost to that home visiting program for Children's Trust. It would be $5 million in one-time funding through the Department of Public Health. The aim is to improve maternal health outcomes and save lives. Sue Williams is the executive director of Children's Trust.
So this would allow us to serve many more moms. Right now we're serving less than 10% of the eligible moms, and this would allow us to serve many more.
Another $1.5 million of the department's budget would go to the South Carolina Network for Child Advocacy Centers. Lawmakers will decide in the coming weeks whether to include these requests in the House version of next year's state budget. Reporting at the State House, Josie Frost, News 19, WLTX.
And the new fiscal year budget begins on July 1st.